All right, so let's dive in. Today, we're looking at some recent news about HIV/AIDS in Papua.
Specifically Papua and Papua Pegunungan in Indonesia. Right.
Exactly. And the articles paint a pretty concerning picture.
Yeah, some worrying trends there.
It's not just the numbers that are alarming, but also what this means, especially for the indigenous population there.
Right. The potential impact on the communities is huge.
We've got articles here with perspectives from all sides: government officials, health experts, even community leaders.
So, a pretty comprehensive view of the situation.
Okay, let's jump into the numbers. In Papua, over 20,000 reported cases of HIV/AIDS.
Wow, and over 1,800 reported deaths.
Papua Pegunungan, almost 10,000 cases, 709 reported deaths. Is this as serious as it sounds?
It really is. What's particularly concerning is the potential impact on the indigenous population in Papua Pegunungan. There's this concern about a potential decline in their numbers due to HIV/AIDS. It would be devastating.
So yeah, definitely not just numbers on a page. The Department of Health in Papua says heterosexual contact and multiple partners are the leading cause of transmission. Is that kind of in line with global trends, or is there something specific here we need to understand?
It's a good question. It's definitely a significant factor globally. But in Papua, it might be linked to some unique social and cultural factors.
Oh, interesting.
Which means we need to go beyond just general awareness campaigns.
Makes
That the education needs to be tailored to these communities specifically.
So not a one-size-fits-all approach to prevention. Okay, the articles also mention this group, the KPA. What's their role in all of this?
The KPA. They're the ones on the ground doing the work.
Like boots on the ground fighting HIV/AIDS.
Exactly. The Komisi Penanggulangan AIDS. They do everything: awareness, testing, counseling, supporting those living with the virus.
Sounds like they're pretty essential then, especially with all the challenges we've talked about. One article mentioned the Bureau. They've got over 10,000 cases there, and some frustration with the KPA's leadership.
Yeah, there was a sudden change in leadership.
Oh, okay.
Which, understandably caused some concern.
Yeah, I bet.
The KPA needs stable leadership to manage programs and resources effectively, especially during a public health crisis. And of course, consistent funding too.
Right. Makes sense. You need the right people and the resources to make a real impact. Speaking of leadership, the city secretary of Kota Sorong, that's a rapidly growing city, he's voiced some concerns about the potential for increased HIV/AIDS transmission there. They've already got over 4,000 cases and 482 deaths reported in Kota Sorong. Is this a case of too little, too late? What are the challenges of managing public health in a rapidly changing environment like that?
It's a race against time, for sure. What makes cities like Kota Sorong vulnerable is the constant influx of people and the growth of certain industries, entertainment, hospitality.
Right.
It's like trying to build a safety net while the ground beneath you is constantly shifting.
Wow, yeah, I see what you mean.
So you have to be incredibly adaptable and proactive.
Makes you wonder how they even begin to tackle all that. Papua and Jayapura, 400 new cases each year. It's the leading cause of death there. What makes this region particularly susceptible? The head of the health department stressed the need for support, not just from health officials, but from everyone. Community leaders, religious institutions. Why is that so important in this specific region?
Papua and Jayapura seems to be facing this perfect storm of challenges.
Oh, how so?
Well, you've got this high concentration of new cases, right? But then you also have limited access to healthcare in some areas.
Yeah, on top of that.
There are these really deeply ingrained social stigmas.
Oh, I see.
And that prevents people from seeking help.
Makes it hard to even talk about it.
Or disclose their status. So that's why it's crucial to involve all sectors of society.
Okay, yeah, everyone needs to be on board.
Community leaders need to promote awareness, encourage testing.
Right.
Or religious institutions, they can play a role in destigmatizing the virus, offering support to those who are affected. And even those in entertainment, hospitality, they can help spread the message about prevention.
It's like changing the whole conversation around HIV/AIDS.
Exactly.
Not just focusing on the medical side. Something else that stood out to me, the age group most affected in Papua and Jayapura, it's 18 to 59.
Yeah.
That's people in the prime of their lives. What are the long-term implications of that?
Well, it's tragic on so many levels. You're losing a big part of the workforce, which impacts the local economy. Families are being torn apart, and the potential for future generations, well, it's being diminished.
And the articles mentioned people in this region struggling to stick to their medication because of the stigma, lack of support.
Absolutely.
That must add another layer of complexity.
It does. Access to medication, that's just half the battle.
Right.
If you're afraid of judgment or discrimination, it's hard to manage your condition.
You can't get healthy if you're living in fear. This whole conversation makes me think about the other regions we talked about. Is this level of concern consistent across Papua, or are there areas more heavily impacted?
Well, if you're looking at the province of Papua, Kota Jayapura has the highest number of cases.
How high are we talking?
Over 8,800. Then Kabupaten Jayapura, over 5,300.
Wow.
But there are other areas with significant numbers. Biak Numfor, Kepulauan Yapen.
How many?
Over 3,200, over 2,000 cases, respectively.
So it's definitely concentrated in certain areas.
Yeah.
But it's widespread. Honestly, it's all starting to feel a bit overwhelming. Are there any bright spots? Any efforts showing promise?
Oh, definitely. There's always hope. Organizations like the KPA, they're making a difference.
Even with the challenges?
Even with the challenges, yeah. They're always trying new things,
Like what?
Well, the KPA in Nabir partnered with a local radio station.
Cool.
To broadcast information about HIV/AIDS.
That's a great idea.
Right.
Radio is so accessible, especially if internet access is limited.
Exactly.
It sounds like they're finding creative ways to reach people. But just awareness alone won't do it, right? What about treatment and prevention efforts?
It's all about a multi-pronged approach.
That makes sense.
They're also focusing on testing, counseling services, supporting those living with HIV/AIDS,
right,
and advocating for more funding for treatment programs.
They've got their work cut out for them.
Yeah.
I keep thinking back to what that health official said about needing everyone to be involved. It can't just be the healthcare providers and the KPA. How can everyday people contribute to a solution?
It can be simple things. Talking openly about HIV/AIDS.
Break down the stigma.
Yeah. Or even volunteering time or resources to local organizations.
So it's about people stepping up saying, hey, this is my community. I want to be part of the solution. But I imagine it also requires a shift in mindset, right?
Right.
It's not just a medical issue.
Exactly. It's a social and cultural issue, too.
Right.
We have to address the underlying factors that contribute to the spread.
Like
poverty, inequality, discrimination.
You're talking about a much bigger picture. We've covered a lot of ground here. Anything you think is important to really drive home for our listener, to understand the complexities of this issue?
It's really about understanding that the fight against HIV/AIDS in Papua, it needs a multifaceted approach.
It's not just about meds or raising awareness.
Right. It's about those social, cultural, and economic factors, too, the things that really contribute to the spread.
Sounds like a massive undertaking. But listening to you, there's a sense of hope, too.
Oh, absolutely.
The people on the ground are dedicated.
They are, and they're coming up with some really innovative ways to tackle these challenges.
And that's where it's important to remember that even though it's serious, it's not hopeless.
Exactly.
With more awareness, better education, and strong community support, we can make a difference.
We can.
It's inspiring to hear about the resilience of these communities and their commitment to fighting for a healthier future. We've been focusing on Papua, but this makes me think about the global implications of HIV/AIDS. What lessons can we take from Papua and apply elsewhere?
I think one of the biggest takeaways here is the need for culturally sensitive interventions. What works in one place might not work in another.
Right, different approaches for different contexts.
Yeah, and we have to listen to those communities, understand their needs and beliefs.
Tailor our approaches.
Yeah.
No one-size-fits-all solution. This deep dive has been eye-opening. We started with some pretty stark statistics, explored the complexities of HIV/AIDS in Papua, the challenges, the potential solutions. What's the one thing you really want our listener to walk away with?
More than anything, I hope they feel informed and empowered, not overwhelmed. The situation in Papua is a reminder that even when things are tough, even with a serious health crisis, there's always hope. And we can all play a part in this fight.
Locally and globally. It's easy to feel helpless with a problem this big. But knowing that we can all contribute, that's encouraging.
Yeah.
So to our listener, we challenge you. Take what you've learned today and do something with it.
Learn more, get involved, be a part of the solution.
That's what it's all about. Thanks for joining us on this deep dive. Until next time, keep exploring, keep learning, and keep the conversation going.